Alrighty, so whenever you're ready, I can get started and introduce you.
Sure, yeah.
All right. So thank you for being here and participating in a community outreach event for us at Stony Brook Eastern Long Island Hospital. We're happy to have you present for us today. This is Jerry Simons, PAC, graduated from SUNY Stony Brook's Health Science Center with a degree in cardiorespiratory sciences and went to graduate from Cornell University Medical College's Physician Assistant Program. He is nationally certified as a physician assistant with commendation in both primary care and surgery. Jerry is a clinical assistant professor on the faculty of the Stony Brook University Physician Assistant Program and is an instructor at several major universities. He is an award-winning international medical education lecturer and has developed educational programs used by physicians and health providers and is a published author on Lyme and Tick-Borne disease. In 2010, he won the national award from the Tick-Borne Disease Alliance. And in addition to teaching at Stony Brook University, he also teaches at the Marison Center in Watermill. Jerry has been a member of the medical advisory panel to the Regional Tick-Borne Disease Resource Center at Stony Brook Southampton Hospital since its inception in 2014. So whenever you're ready, we'll leave questions for the end.
Yep, yeah, we'll definitely take questions at the end. And you can hear me okay, and you can see my slides, right?
Correct.
Fantastic, great. Okay, hello everybody. My name, as you just heard, is Jerry Simons. I'm excited to talk for Eastern Long Island Hospital tonight about all the news about Lyme disease and everything else in between. I was one of the first medical advisors for the Regional Tick-Borne Disease Center at Southampton. And luckily online, we have Karen Wolfrat, who's our administrator, and also Rebecca Young, who is probably the most famous voice of the Southampton Tick Center. She answers our phone number, 726-TICK. So if you have questions about a tick bite or finding a doctor or blood work, Rebecca definitely out there is a good one to help you out for sure. So really excited. Last year, the Regional Tick Center, we pioneered our own reference handbook on tick-borne disease, which you can see here. And I'll give you info later on how to get a PDF mailed to you, or there'll be some community events if you're an old-fashioned like paper kind of a person. So we'll give you info on getting that as well. One of my favorite websites, tickencounter.org, Thomas Mayer had one of those famous quotes, "One bite can make you sick and change your life." So one of our big focuses for tonight is to really make sure you know how to prevent getting those ticks on you, because preventing tick bites is going to be the key to avoiding a lot of these other problems. So as you heard, my name is Jerry Simons. I've been advisor to the Tick Center. I teach at Stony Brook. I practice in Watermill at Dr. Morrison's office. I've worked with the Tick-Borne Disease Alliance, which is now the Global Lyme Alliance. A medical advisor in the past for the Tick-Borne Disease Alliance, and I've written for the Lyme Time magazine. So I've been around the Lyme community for a while for sure. So what are we going to do tonight? We're going to talk a little bit about what Lyme infection is. We're going to go over some of the hot news stories that you're probably seeing on social media about Lyme. We'll go over other infections because we know that Lyme disease gets all the attention, but there are things like Bartonella and Babesia and Rocky Mounted and Heartland virus that, you know, are also very, very important. We'll talk about the different types of ticks, a little bit about diagnosis and treatment, and also prevention, making sure you don't get ticks. And, wherever you are, especially on Long Island and the Northeast, it seems like ticks are everywhere, on us, on our pets, in our yard. So, in the word of tick encounter, are we actually in a tick-nado? Like, ticks are everywhere. Also really exciting, at the end of the talk, I'll tell you about the Tick Center. We have these exciting tick kits, which are for free. They come with the little special forcep, magnifying glass, a cool little card so you can help to identify the ticks that are on you. So we'll give you great info on how to get both the guidebook and the free tick kit towards the end. And just pop any questions in the chat. We'll go over that as we go along. Again, talking about Lyme disease and tick prevention can be controversial. There are a lot of different opinions. Most of all the slides we're going to go over have a really good reference, and I'll let you know when I'm putting my own 2 cents in there for sure. So guess what, everybody? We're going to do a pop quiz, right? And either write these answers down or think of them in the back of your head, and we're going to figure out the answers as we go along. So number 1, ticks only make you sick if they're attached for more than 24 hours. True or false? Lyme is the only serious tick illness. True or false? That's an easy one because I kind of just answered that for you. Alpha-gal meat allergy can be deadly. True or false? Everyone with Lyme remembers the tick that got them. True or false? The CDC says a positive Lyme test is required to diagnose Lyme. True or false? A tick can give you more than one illness. True or false? A summer flu could be a tick illness. True or false? You could only get a tick bite in warm weather. True or false? And 90% or more of people with Lyme get over it easily. Well, we're going to figure out these answers, and we're going to do this quiz again at the end. So some key things before you start getting distracted, a couple of key pointers. Number 1, tick diseases are on the rise almost everywhere. Warmer weather, climate change, suburban expansion, moving into habitats are some of the key reasons. Also, some zip codes are reporting a higher prevalence of deer as well. The second key point is that tick diseases really are preventable. If you don't get bitten by a tick, ideally, you're not getting any of these illnesses we're talking about. Common sense prevails. Don't walk through tall brush. Avoid going off of the trails when you're hiking. Getting rid of mice and birds from your yard are key to eliminating the cycle of the tick population. And we always talk about at least 2 layers of protection. Putting something on your skin and then putting something on your clothing, which we'll talk about. I even have some patients that use duct tape and they put the sticky side out, and that actually captures ticks on around your socks and things like that. Very important to remember that to remove a tick as soon as you find it. Label the tick and save it. And we're not covering it with oil. We're not burning it off with a lighter. We're removing using a very fine tipped little tweezer to get rid of it. At least in our area, the east end of Long Island, when we think of the summer flu, very often we think of tick disease first. You can still get influenza during the summer. You can also get COVID during the summer, but definitely in endemic areas, tick diseases can present as a summer flu. So we have a very high level of suspicion, especially over the summer, if somebody comes in with flu-like symptoms. And nowadays we can do a nose swab or a throat swab for flu and COVID and know pretty quickly that those things are negative. Plus, a lot of patients with Lyme and a summer flu don't have those classic respiratory kind of symptoms that way. So again, what is Lyme disease? Number one, it's not Lyme's disease with an S, it's singular, Lyme disease, right? Lyme disease are these little corkscrew shaped bacteria that can actually drill into cells and tissue, getting very deep into your body. So Lyme disease is a bacteria which can make people and pets ill. And there are many variations of Lyme disease. Some people get Lyme disease and it's neurologic. They get headache and mood changes. Some people get Lyme disease and it's just in the joints. Their knees and ankles can swell and be tender. You've definitely heard of people getting even Lyme disease in the heart, where their heart rate gets very slow. Sometimes people even need a pacemaker for that. So when we talk about Lyme disease, we know the name of the bacteria is called Borrelia burgdorferi, which you get from an infected tick. It bites you and you get Borrelia burgdorferi, the name of the germ. But we also know that there are many other strains of Borrelia which also can give you Lyme, like Borrelia mayonnae, Borrelia garnii, Abzelii. So there's a hot debate in medicine. When we talk about Lyme disease and the Borrelia bacteria, many places like the CDC define it as Borrelia burgdorferi, but many other places like Mayo Clinic say you could have any one of these 4 infections. And people, crazy but true, I've seen people where we document that they have Borrelia burgdorferi, but then they also have, for example, Borrelia mayonnae. So they have 2 different kinds of Lyme infection. And sometimes they may actually need 2 different types of antibiotics to get over it. So if we know you have Lyme disease and you take an antibiotic and you're not fully better, sometimes it's actually a different strain. And a topic for another day is this really interesting article from Stanford where they talk about after treating Lyme disease. People, look at this. After treating Lyme disease, for 10 to 20% of patients, the disease persists with joint pain, neurologic difficulties, and fatigue, other things like that. So, and I generally agree with this article. If we catch Lyme disease very early, they have a rash and no other symptoms, and they get 3 or 4 weeks of antibiotics, they're usually fine after that. It's the 10 to 20% of people which can have these really long-standing symptoms. So if you think in a typical Hamptons weekend, if 100 people get Lyme disease, that could be 10 people with long-term symptoms. And that's another really hot debate. After treatment, is there a continued infection or what's really going on with the immune system? We could do another talk about that. So when we think about Lyme disease cases, no surprise here, most of the symptom onset peaks in June and July. But what's really interesting is you see that there's confirmed Lyme disease with symptoms all through the year. So we now know, especially with climate change and things of that nature, that temperature changes are facilitating tick movement all through the year. So it's not uncommon for somebody to need doxycycline because they have a tick infection in December and January. So we're seeing more and more of this data over time. Look at this back in 2001. Every blue dot is a case of Lyme disease. Naturally, the Northeast, Mid-Atlantic, look, even down in Florida, Texas, middle states, Wisconsin, even down to Chicago area, West Coast. So take a look at that. And now everybody, look at this, right? You can see by 2011, there's a lot more cases of Lyme, especially in the Mid-Atlantic, Northeast, Wisconsin area. And then now even more, right? So we definitely are seeing that Lyme disease seems to be spreading. Don't worry, Massachusetts didn't participate in this particular study. It's not that there's a lot of Lyme in Massachusetts, as we know, if you're looking at that one particular outlier there. So Lyme disease, we definitely know it's spreading, but there's also a heightened awareness. More and more people are testing for it. They're hyper vigilant about symptoms. So as we look for it, there's also a greater list of greater amount of diagnoses as well. Here's a really interesting article from 2012, predicting the speed of tick invasion, looking at the expansion of Lyme disease in Canada. Everybody, I hope you're sitting down out there. Look at this. In 2012, they documented that every year, the warmer climate pushes Lyme disease 4 kilometers deeper into Canada. People, in 2021 and 2022, there are towns and villages in Canada experiencing Lyme disease, and these doctors and PAs and nurses years ago never ever saw Lyme disease. So there's a gradual northern spread, again, due to migration changes, climate changes, warming, things like that. This particular article is a part of a series of articles showing over the last 19 years that a warmer climate show there are more baby ticks, what we call larvae, and more nymphal ticks. There are more of them. They come earlier in the season and stay later. So when we talk about climate change and its effects on healthcare, Lyme disease truly is an important factor in dealing with all of this. So that's definitely a big deal. In fact, if you go to the CDC website and even this famous tickencounter.org picture, one of our famous websites, write that down if you haven't written that down yet. They actually have a picture of a tick in Vermont, actually in the ice, right? So again, all year round, you have to be concerned about tick attachments. Naturally, spring into summer is some of the more risky areas. So when someone gets bitten by a tick, I kind of consider that tick bite to be like you're stepping on a needle, like nature's dirty needle. Ticks can live for 2 years in the dirt, drink the blood from all kinds of animals and people. They attach to birds and reptiles and rodents. So yeah, getting a tick bite is like getting poked with a dirty needle. We don't like that. So what are you going to do if you get bitten by a tick? Ideally, removing the tick with a very fine tipped forcep is the way to go. In our official Southampton tick kits, which everybody's eligible to get one, we've really designed an excellent prototype of this very fine tipped tweezer or forceps, which has gotten rave reviews over the last few years for really being effective at removing a tick. There are different types of tick spoons and plungers, which you have to be skilled at because there's always a chance that you could break the head of the tick off. So you've got that tick on you, you grab as close to the skin as possible, pulling it straight out perpendicular to the skin. As I already warned you, don't cover it with oil or glue. Don't try to light it with a match, hoping it's going to back out of you. All that does is piss the tick off, and it can regurgitate any of its infection into you. So people, just pull your tick off. Don't piss it off. Don't get it angry, right? Clean it with alcohol. Our tick kits have a little packet of bacitracin, mupirocin, that you could apply directly to the site. I'm also a big fan of iodine, which kills everything. It's the active ingredient in betadine, the surgical soap. And I tell people, get that iodine on there, leave a dark brown spot, and just leave it brown. Save the tick either in a jar or a Ziploc bag. Don't squish the tick. You can label it. note where it is exactly on your body. And there are options to test your tick, which is kind of controversial. I'll go over that in a second. Definitely take a picture of wherever the tick bit you. Maybe use a ruler or put wax paper over it and circle any skin changes. And take pictures every day for a few days. Very cool. You can take a picture of that tick and send it to tickencounter.org, and they'll actually give you a free report. What kind of tick is it? Is it engorged? Is it male, female, baby, teenager, things like that. Naturally, you can watch for symptoms. If you have a rash, that's obviously Lyme. If you develop flu-like and headache, then we definitely know that you need treatment. Antibiotic prevention. We could have a whole hour talk on which tick bites should be given antibiotic prevention. But ideally, since deer ticks are the ones that transmit Lyme, doing prevention for that makes sense. An engorged tick, a fat tick, no longer flat, we know that's been feeding. Ticks attached for more than 24 hours. So those are some of the criteria that we use for antibiotic prophylaxis after a tick bite. There are some landscapers, every April 15th, they go to their doctor or their PA, they get a bottle of doxycycline, and they're just taking them prophylactically because they know they're going to have tick bites all through the summer. Again, if you have any danger symptoms like flu-like, fever, rash, you need treatment. And a really cool tick, not a cool tick, a bad guy, but a really cool trick is if you get bitten by a Lone Star tick, which can give you that alpha-gal meat allergy, I generally tell people don't eat any meat or any meat products for a month. And that will not necessarily trigger that alpha-gal reaction. Not scientific, just my own personal observation about a lot of patients with Lone Star tick bites. I tell them don't eat meat and meat products for a month, and many of them are not coming back with alpha-gal. So it is controversial. Should you test your tick? There are a lot of companies, like Ticknetics is one of the more famous companies. And we know that certain ticks are more likely to carry infection than others. We're going to go over that in a minute. We also know that many of these tick testings can be very expensive. If you're spending $300 every time you get a tick bite, you may run out of money by Labor Day, right? Also, a tick that has been attached for a period of time, everybody, you listening to this? A tick that has been attached for a period of time may actually inject the infection into you, and the tick is negative, but your skin would actually be positive. So medically, we would say that that tick test is a false negative test. So hopefully when we talk about the types of ticks, you'll know which ones we really want tested and not. So there's a famous medical diagnosis called a tick bite reaction, which is the local reaction you experience at the site of a tick bite. Usually you feel that within a few hours. It's very itchy. It's less than a centimeter. It may expand rapidly over several hours and then start to disappear. Whereas erythema migrans, which is the rash and skin reaction to Lyme disease, takes 3 to 30 days to show up. You're not going to remove a tick and later that night start getting an EM rash. Rare to have local symptoms. Maybe you'll experience some heat. It'll typically expand to over 5 centimeters over several days and can take weeks to disappear. People, I think this is important. If you're taking pictures of slides with your phone, this is a good one to take a picture of, because you could have an incubation period of 30 days. There's that famous t-shirt called Bit, where the t-shirt says, bit in October, sick in November. You're raking your leaves, getting ready for Halloween in October, and next thing you know, 30 days later, you're developing a rash. So very important to keep in mind the difference between those two. So we talked a little bit about how to remove a tick, and just briefly to get everybody interested, we're going to talk about some of the famous Lyme in the news, right? Sag Harbor Express, our local newspaper, had a great article earlier in the year about the 4-poster system, which is one of my favorite ways to reduce tick population. It's basically a feeding system where for the deer to get to the corn or the food, it has to put its head through a poster which coats the neck of the deer with permethrin, which kills and really helps to reduce the number of ticks. These have been used successfully throughout Suffolk County, but again, this is a political issue. Wherever there's a 4-poster system, you're going to have a lot of deer migrating there, and not everybody wants a lot of deer in their neighborhood. So that's a really hot topic. Number 2, Alec Baldwin has been in the news. He was in the news last summer when he really brought up his whole story about Lyme disease, which was not diagnosed and treated in a timely manner, attacking him over a long period of time. Chris Christopherson, the famous singer who had Alzheimer's, had issues with bowel and bladder control, even speaking. His wife finally stood up and said, let's check him for Lyme disease. It was positive. He was given doxycycline. And you can see today it was a pretty remarkable recovery. Yolanda Hadid, if you watch The Real Housewives, same type of thing, deeply affected by a delay in Lyme disease diagnosis and treatment. And probably the most famous story from about a year and a half ago, Justin Bieber, when he was really looking under the weather with rashes and pallor and weight loss and bizarre behavior. People thought that Justin was doing some kind of crazy drug, but it ended up that he had Lyme disease. And after treatment, he is doing remarkably better. So, Lyme disease is definitely out there. Missing that early diagnosis can be problematic. And more and more and more, it's in the news as it affects people that are in the news. Very interesting, about 2 weeks ago, the Pennsylvania Department of Health released an alert about Powassan virus, or the deer tick virus, which they've noticed a big uptake in Pennsylvania. And this is a virus that can have a transmission time in as little as 10 or 15 minutes. And Powassan virus is in the Northeast, definitely endemic in this area of Pennsylvania. We found it in Suffolk County, Massachusetts, upstate, things like that. And Powassan virus can include things like fever and headache and weakness, vomiting, so very non-specific symptoms, but we want to keep vigilant about keeping an awareness of these acute onset of symptoms. It may not be a bacteria like Lyme disease, could be related to a virus as well. And again, very interesting, according to the Minnesota Department of Health, symptoms of Powassan can appear within 1 to 4 weeks of a tick bite. So you can remove a tick and you're writing the date and you're keeping the tick, because we will be watching for 30 days to see if any of these symptoms come out. A really important story, Karen from the Tick Center knows I have to mention this in every talk, the moose population being devastated in Vermont, New Hampshire, and Maine. And moose are ideal vectors for carrying ticks, both their breeding and location where they live, how they interact with other moose. And, they've literally found like 10,000 ticks on a moose. And in 2017, they were documenting in the Boston Globe that ticks were killing about 70% of moose calves in Maine and New Hampshire. Look at that. Winter ticks can attach to a single moose by the tens of thousands. So I always tell people, when I was in high school, we were always talking about save the whales, save the whales. Now we should be telling people save the moose, save the moose. And new data just released on the Adirondack Association website, there's less than 900 moose still alive in New York State. And that used to be in the thousands. Again, we go back to our talk about climate change and other issues that way, which is affecting all of this. Really bizarre, just released yesterday, a Cornell vet school researcher looked at American white-tailed deer, which we have here on Long Island especially, finding that in their respiratory canal, they can transmit COVID. And they've actually found that, in people that work with deer, either on a farm or through harvesting, that deer not only carry the ticks that spread Lyme disease, but a really amazing, a blow your mind concept that these white-tailed deer can have a COVID infection rate of up to 40% and can shed and transmit the virus for up to 5 days to other deer and other contexts. So people, already now we have to worry about deer carrying ticks and COVID. And really interesting, but this idea of Lyme disease going on for a long time, persistent Lyme, which I mentioned briefly, has made the New York Times in a big opinion piece, October 23rd, and even February 25th in the Wall Street Journal. So there are probably some people on here that are dealing with long-term symptoms. Take a picture of this slide, read these two articles. There's probably a lot that you'll be able to really relate to there. So we talked a little bit about how to get ticks off of you. We talked about all the exciting Lyme disease news that's out there. We're going to talk about prevention. We're going to talk about symptoms and a little bit about treatment. So prevention is key. If you don't get the tick on you, you don't have to worry about any of this stuff, right, people? Now, the CDC says the most common age group for Lyme are boys between the age of 5 and 10. Makes sense. They're generally outside. They're not too careful, rolling around in the dirt, in the woods, like things like that. I already warned you that if you have a summer flu and you're in an endemic area for Lyme, one of those blue dotted areas that I was talking about in the previous slide, definitely consider Lyme and some of these other tick germs. We also know that blood testing is not accurate early on. If you've had a tick and you're flu-like and you don't have COVID and you don't have influenza, think about Lyme. If you have the erythema migrans rash, that red target-like rash of Lyme, we don't even bother doing blood work. We treat immediately. Also, as I've hinted at, ticks carry more than just Lyme disease. We were just talking about Powassan virus, which is a viral disease transmitted by ticks. Definitely check yourself regularly for ticks when you're outside. And very often, kids with Lyme disease may not have a summer cold or a summer flu. You may notice a change in behavior or school grades. And again, in my hot-headed opinion, if you think someone has Lyme, it's better to treat early rather than waiting to see if the symptoms go away or waiting until the time is right to do a blood test. Very often I'm like, take $30 of doxycycline. It could be better than $3,000 of blood work. Again, that's just my opinion. So when we went back to having a tick on you and knowing when you should test a tick or not, being able to look at a tick and know what it's all about kind of will give you an idea of the steps you should take. As most of you know, there are many different kinds of ticks, and they're in all different kinds of growth cycles: baby, teenagers, adults, male, female, things like that. Typically, the larva is the baby tick. The nymph is the teenager, and then you've got male and female adults. One important thing to remember, write this down if you're taking notes. Larvae, the babies, have 6 legs, 3 on each side. Those usually don't carry infection. So if someone has a larval tick bite, our level of emergency goes way down. If someone has a nymph or an adult, they typically have 8 legs, 4 on each side. Those are the ones where we're definitely more worried about infection. So people, you heard it from the Tick Center in Eastern Long Island tonight. If you get a larval tick bite, save your money. Don't send that out for testing. So spring is the big tick season that everybody thinks about, right? Even though we know ticks go all year long, spring is definitely tick season. And we know that we have the classic deer tick, right? The black-legged tick. Look, this is the only one with black legs, right? We also have the Lone Star tick, which is that famous alpha-gal tick. We have the classic American dog tick, which you'll definitely find on your dog's ears, right? The brown dog, and then the new guy in town, the Asian longhorn tick, which we'll talk about. Just a cool trick, the next time you're at the store, make sure you pick up one of these lint rollers, because I love traveling around with just a lint roller. If you're out and about, roll it up and down around your shoes and your socks, and you'll be surprised. It may pick up little ticks that are crawling on you. So make sure you use a lint roller when you're outside. So luckily here in Suffolk County, we have the Division of Vector Control, which works with our Southampton Tick Center really almost on a weekly basis. Karen could hit on that a little bit later, but this was a report from one of the team members there, which showed the activity of adults, grown-up ticks, right? Which the deer ticks, look, even in January, right, they found activity. They wake up end of February. The adults really die down May and June, and then re-spike as the babies start growing up. This February, March phenomena are probably the adults that are left over from the previous year. Wow, look at that. Look at the nymphal activity, right? And again, the nymphs are the ones we don't like. The nymphs, I like to call them the really hungry teenager, right? All of you parents and grandparents, when your teenager comes back to the house, they're going right to the kitchen. They're hungry, they're eating, right? These nymphal ticks are always hungry, looking to attach to somebody like you or me to get their next big bite, right? So Lone Star really has become more and more prevalent in Suffolk County, replacing much of the deer tick population. And we really see kind of like that August fading out by Labor Day, major spike in the Lone Star nymphs. And many people think that these are actually chiggers, like chigger bites, but we've really never found chiggers in Suffolk. We definitely know that they are Lone Star. So let's go through some of the different ticks so we know what we're dealing with, right? Now, the deer tick, right, when we talk about larvae, and then we talk about nymph, right? The deer tick larvae, which are those little babies, 6 legs, 3 on each side, July, August, September is their peak activity in New England. And again, people, save your money. Don't test a larval tick. Still save it and mark the spot, but you don't got to test it. Deer tick nymph are active May, June, July, August. So they're just kind of getting ready to be active. The deer tick nymph is definitely one where we think about giving a prophylactic dose of doxycycline. Look at the little melody of germs you get from a deer tick. Lyme disease, babesia, that's the parasite where you get sweaty and feverish. It looks just like malaria. Anaplasma, right? Which again is an acute onset flu-like illness with liver stress and low blood counts, anaplasma, you definitely don't feel good. And again, this Powassan virus, which we were just talking about being big news from Pennsylvania. So deer tick nymph, right, definitely are ones where we're much more concerned when people have a deer tick nymph on them. Now, the deer tick female, right? Believe it or not, again, the adults are not that active in the summer. We're thinking more of the nymphal component here. And it's typically that adult female that, again, Lyme, Babesia, Anaplasma, Powassan virus, right? And again, people believe it, but true. If you're taking pictures with your phone, this is another big one. Make this your next TikTok. You know what I mean? Even active, right, all through the winter. You got to be careful of ticks all year round. Again, this is slides that come right from the Tick Encounter website. They're pretty good at updating their data on a regular basis. Hopefully at the end, Rebecca will tell us a little bit about the tick line and what kind of phone calls she gets in the summer compared to the winter. Also really interesting, look how small these nymphal ticks are. They could be in your hair, in your groin, under your arm, and they may feed and fall off and you never know it. So depending on the literature you read, some instances of these tick diseases, only about 20% of people actually remember the tick that bit them. So we have a hypervigilant awareness of these diseases, even in people that are like, I've never been bit by a tick. Well, actually, you could have been. You just don't remember it. Dog ticks, now they, fundamentally look different. We see more of the brown legs here. Dog ticks really do not transmit Lyme disease. We don't give prophylaxis really for dog ticks. There are still some dog ticks around, but again, they've kind of been bullied out by this whole really aggressive Lone Star tick. So when we think about, again, dog ticks, right? Larval, babies, 3 legs each side, nymph, adult, male, and female. In the New England, Long Island area, right, April to August, May, June, July is really when they peak, right? Now, dog ticks, we also have to be nervous. They can transmit Rocky Mountain spotted fever, where people develop that rash, which can be really serious. And they could also transmit tularemia. We don't see that very often, but there are definitely cases of adult female dog ticks and people getting Francisella tularemia. So typically when a patient calls me up and they're like, I have a tick bite, I'm like, that doesn't really help me. Can you bring the tick in? I want to know the type of tick and if it's a larval, nymph, or an adult. And again, in my opinion, if you use the Tick Encounter website, if you identify that it's a larval tick, you can save your copay, people. You really don't have to take any action. You might have a little tick bite reaction, but typically larval ticks, we don't really worry about that. Wow, Eastern Long Island, we're saving you a lot of money on copays and tick testing tonight. This is incredible. Now, what about the Lone Star tick, right? Everybody knows the Lone Star tick, the female has that classic white dot on it, right? And again, the big thing we're worried about on Long Island with Lone Star ticks is the transmission of this alpha-gal meat allergy. And as I said, we definitely have nymphal Lone Stars, not chiggers. My own opinion, if you remove a Lone Star off of you, stay away from meat and meat products for a month so you don't trigger that alpha-gal reaction. Now, also, Lone Stars, we worry about Ehrlichia and we worry about tularemia, both in the nymphs, the hungry, aggressive teenagers, and the Lone Star female as well. So definitely important to keep that in mind if someone has a nymphal tick bite. Really, August to October is when we're seeing these nymphs. This is a picture a patient sent to me. And look on her inner toe, right? All of these little dots are little Lone Star, nymphs. So again, not eating meat, looking out for these other infections. So many people never see the Lone Star that got them, but they do start noticing that they're eating meat, they have a reaction, and we even know that you can get a severe anaphylaxis. People have needed to go to the emergency room, getting steroids and adrenaline, and even having to be intubated. So alpha-gal can definitely be life-threatening. Good news here in Southampton, a member of our medical advisory panel, Erin McGinty, is one of the leading allergists studying alpha-gal. So Rebecca has great info on contacting her if you need help managing your alpha-gal. Really interesting. This was just published in December from the journal Emerging Infectious Disease about Heartland Virus, which is another virus that can be transmitted through Lone Star tick bites, right? And here's the actual story, right? Showed that white-tailed deer, of course, are all over Suffolk. We know that already, and that they were actually able to document Heartland transmission virus in a patient after having a tick bite. Also, the new tick in town, you might have heard of this, the Asian Longhorn tick. People, you were expecting house guests. Most everybody in the Hamptons and the North Fork has house guests all summer long. This is one house guest you really don't want to have. The Asian Longhorn tick, right? The Suffolk County Vector Control documented Asian Longhorns in Southampton, in Islip, in Northport. So they're moving basically up the Atlantic coast. And I saw a report even of an Asian Longhorn in Maine, but I wasn't able to clip and add that into the presentation. So Asian Longhorns, the Entomologic Society of America actually was documented that Asian Longhorns can carry Lyme disease. And if you read our local newspaper, Newsday, that was a headline about these Longhorn types of ticks. They have more of a prevalence for animals than people's skin, which is kind of good news. And this is yesterday's update from the CDC. Asian Longhorn ticks, you can find them on livestock, pets, wildlife, and people. This is really bizarre. Look at this. The female tick can lay eggs and reproduce without mating. She can lay 1,000 eggs just on her own. And they live literally in a nest. And the CDC documents that you can find 1,000 Asian Longhorn ticks on a single animal or in a nest. And they're still trying to figure out whether they prefer wooded or open areas. And they found them basically from Connecticut, West Virginia, Long Island, all the way up and down. The good news is compared with the black-legged tick, the dog tick, Asian Longhorn, it seems to be less attracted to human skin. Good news for us. And they also have documented that they can carry Rocky Mountain spotted fever. So look out. And again, we want to know at the Tick Center, if you get an Asian Longhorn tick and you get it in a Ziploc bag, make sure you email Karen, because that is a tick that we want to study. And we'll give you her contact info at the end. And another unwanted guest, the Gulf Coast tick, which the Suffolk Vector Control documented that they found in Islip last summer. Great Gull Island, they're all over Staten Island. They've been found in Connecticut. So you thought that Lone Star, deer tick, dog tick, Asian Longhorn. Now we've got another visitor, the Gulf Coast tick in the neighborhood. So when we think about where all these ticks are and all the different germs that these ticks can carry, we talked a little bit about Lyme, Rocky Mounted, Anaplasma, Ehrlichia, Babesia. There's even a syndrome called Tick-Borne relapsing fever. And you can see that there is definitely some geographical, some wide distribution there. Look where we are right on Long Island. Lyme, Babesia, the malarial type illness. So again, when we talk to a patient, knowing where they got the tick bite, also going to help us figure out what kind of disease we know is endemic in that area. Now, if you're still listening, maybe you're taking notes. I've said that many of these tick diseases can take 30 days to manifest. So if you're vacationing in Cape Cod and then you travel home to Chicago, and then 30 days after that trip on Cape Cod, you start getting symptoms, you're going to need to remember to look and help to make that connection, because you might be in a completely different state or zip code when your tick symptoms show up. So all of these ticks get infected and they get the germ by feeding and biting on an animal that has Lyme, like birds, mice, chipmunks, things like that. So the tick doesn't magically get infected. It has to get an infection from one of these vectors. That tick then passes the infection on to another animal, like a deer or a chipmunk, a mouse, a bird, things like that. So right away, reducing these, rodents, reducing deer exposure is critical to reducing Lyme in our community. So the tick on average, the black-legged, the deer tick, will live for about 2 years. Now, the mom tick can lay like 1,000 eggs. People, look at this. These are 1,000 or more new ticks coming to get you, right? Now, there's one study that shows if the mom tick is infected with an infection, that the larval may be infected, but that it really can't transmit that. So that's another hot area of research right now. So you've got the larva. The larva needs to eat. A mouse, a bird, or a chipmunk is its typical go-to. The larval grows into that hungry teenager, and through the fall and winter becomes dormant. And then that nymph looks for the second meal. A person, a mouse, a dog. Remember, how do we remember nymph? A nymph is a hungry teenager coming to look for a meal, right? The nymph becomes an adult, and then it wants its third meal, person, deer, dog, things like that. And then it goes through the life cycle all over again. So really reducing the vectors, mice, birds, deer, things like that are going to be critical to reducing the tick exposure in your house. So of course, the reason we're all here tonight is we know that ticks can pass the germ onto people and pets, which then make us sick, right? So I'm going to talk a little bit about prevention, and then we'll wrap it up with a little bit of diagnosis and treatment, and I'll hang around for questions at the end. So when you talk about prevention, prevention is never one thing. It's a multiple level. Taking care of your yard and your lawn, being situationally aware, not walking through tall grasses, not walking through tick endemic areas, using protection on your skin, using protection on your clothing, and getting the community involved, getting 4 posters, working on deer control, helping research, supporting the county research, things like that. In your yard, people, tomorrow when you go out in your yard, I really need you to get rid of your bird bath, get rid of your bird feeder. These things attract birds, and we definitely know that birds carry ticks, like this poor bird right here, right? They stop for a bird bath or they stop for feed, those ticks drop in your yard. And bird baths and bird feeders can attract mice and chipmunks, which also can transmit infection. These lovely little mice love compost. They love leaf piles, debris piles. Really getting rid of those or putting them as far away from your house as possible is key. And many companies now offer tick and like deer bait boxes, basically, which mice and chipmunks can run through, and it uses a permethrin coating. So a tick bait box is another really cool thing that you can use. Also, we know that owls love to eat chipmunks and mice. So many people, the hot backyard accessory is an owl box, hoping to attract an owl to your backyard. And those will then reduce some of these vectors. Keeping your grass really short, even considering letting it burn a little bit in the summer. Putting a 3-foot wood chip border around your yard. Ticks will not crawl over a 3-foot wood chip border or a rock border, something like that. Very important to remember that ticks die when they dry out. Short grass that's a little dry is not going to be conducive to ticks. Consider having your yard sprayed, both natural and synthetic. And again, Karen, our administrator, has some great info on the local vendors that use all of our different protocols if you need help figuring out what to do with your yard. There's that terrible little mouse. And you can, if you look carefully, its ears are all covered with ticks, right? You do not want this guy in your yard. So eliminate mouse habitats, get rid of birds in your yard, things like that. This is a great picture from the Connecticut Agricultural Department, which shows like how to keep your yard safe, right? You've got a swing set or a patio, you've got a deck. Definitely around the perimeter of your yard, you want that 3-foot, or they even recommend 3-yard, migration zone, and keeping things like wood pile, compost pile, things like that out of the way. And on the other side of this migration zone. So you're kind of creating like a safe area there. And again, Karen's got contact info on people who have actually, working with our center, help people to design a safe backyard. I've got a college student and a teenager, and I certainly, even when they were little, I let them go outside. You don't want to stay inside paralyzed by fear of ticks. So there are resources to help your yard look as good as this Connecticut Agriculture Department example. Now, when we think about tick prevention, we think about prevention before you go out, during, and after, right? Before you go out, if you know you're going to be potentially exposed to ticks, it's 2 layers of protection. Number 1, using a protectant on your skin. Number 2, using clothing protection, including your shoes, right? For example, on your clothing, using something like permethrin or permethrin, both on your clothing, on your socks, in your pants. And I told you about that trick of using duct tape with the sticky side out. So very critical, you've got 2 layers of protection. You've got something on your skin and something on your clothes, right? We advise people to travel with a lint roller, as I said, occasionally running it up and down your legs. We advise people to bring extra tick spray. And of course, you're going to have our official Southampton tick kit. And it's got this cool little clip so you can keep it on your bag or close by you. So using repellents, for example, something like DEET, right? Like Cutter DEET repellent is a classic, which you can use on your skin and clothing. The natural version, like a plant-based lemon eucalyptus, probably this Repel is the most famous example. Very safe for kids, adults on your skin, for example. And then using that Sawyer's permethrin outer. So you've got something on your skin, you've got something on your clothing, right? The hot Southampton and Greenport fashion statement, like this guy tucking your pants into your socks, preventing the ticks from crawling over. And look at this guy, right? Using sticky tape on the outside, must have gone through a nest. Like, look at all those ticks that might have normally been on his skin. Of course, you're going to wear light colored clothing so you could see those ticks, right? Remember that ticks hate the scent of lavender. Washing with lavender soap, detergent, and shampoo, using dryer sheets, lavender scented dryer sheets, all helps to prevent ticks from being less attached to you. Again, if you're going to a high risk area where you know there are ticks, if it's an occupational hazard or a camping or something like that, using a little bit of DEET on your skin, I don't necessarily think that's dangerous. It's better than getting a tick on you, right? And as we said, permethrin on your clothing and shoes are amazing at keeping ticks away. And if you see a tick crawling over a pair of pants with permethrin on it, you actually see it like curl up and die, right? Many companies like Land's End and REI Camping have pre-impregnated clothing, which is pretty interesting. So oil of lemon eucalyptus, or DEET on the skin, and permethrin on your clothing is an amazing double whammy, including lavender soap and shampoo when you shower. Obviously, situational awareness, right? You're not going to walk off of the path. Even this person here, I think, is a little too close, right? I don't even know if I would be walking in this environment personally, right? So again, stay out of those high areas, because even in winter, ticks will quest. They hang on the end of a leaf or a blade of grass waiting for you to come by. You brush up against them, and that's how they get you. We call that questing, right? These ticks, they don't fly, they don't jump. We do know that Lone Star ticks can sense our carbon dioxide and can kind of walk towards us. But the typical deer, black-legged tick, is lazy. It's going to hang out on a blade of grass, wait for you to come to it. Lone Star ticks will smell your carbon dioxide and come after you. If you're taking pictures with your phone, this is another great one. The Environmental Working Group, which is an environmental think tank, reviewed many of the different types of insect and mosquito and bug repellents, and using things like picarton and DEET give you a very short protection time at a low percent. Long protection time using picarton, using DEET, and oil of lemon eucalyptus, again, which is the Repel or a similar version, probably one of the more popular tick repellents right now for use, especially on your skin. Here's a great study which was done in Arizona, this is more particularly for mosquito, but again, very many similarities to Lyme. And they actually found that this lemon eucalyptus insect repellent, excellent even 4 hours, right? Almost as good as using DEET. So using DEET, using lemon eucalyptus, excellent repellents on your skin, then combining it with a second layer of protected clothing. Really great article that came out in 2018, continued showing that permethrin treated clothing, really good at going after pretty much every kind of tick. So if you're taking notes, I would say using the lemon eucalyptus on your skin and then the permethrin on your clothing is an excellent repellent strategy. And remember that permethrin will survive several washings. so you don't have to spray it on that pre-treated clothing. I tell many people at the beginning of the year, buy a couple of sets of clothes that you don't really care about too much and just cover them with permethrin and use them all through the season. And again, don't forget to spray your shoes and socks also. So we talked about getting ready during your activity and after your activity. After your activity, remember to remove all your clothing, put all your clothes in the dryer, and do a very careful tick check all through your entire body. Parents and grandparents, look at your kids and pets, and shower very soon after being outdoors. The other classic joke that Karen and Rebecca know I always like to say is, after you're out exploring in Southampton, you're out at the Red Bar, at the, having a drink, socializing, you're trying to, get someone really attractive on a date, you could always recommend, well, Eastern Long Island and the Southampton Tick Center recommend that I remove all my clothes and do a careful tick check. And I really want you to help me with that. So it might be a cool dating tip. Think about it. It's kind of funny. The last part of prevention is really getting out there in your community, working with politicians to mitigate the deer population, encourage further research, get more of these 4 poster systems that are out there, just getting the word, getting funding for all the work that we're doing. Really interesting, last week, Congress put out a commendation to the National Institute of Health, which is doing pioneering research on maternal fetal Lyme disease transmission. Could a mom with Lyme actually transmit it through the placenta to the baby? Freaky, but true. Also, here we are, Eastern Long Island Hospital putting on this event, and the Tick Center, supporting us with all of our activities, also really important. Okay, as we wrap it up, I'm going to talk a few minutes about Lyme symptoms, diagnosis, and treatment. And most all of us know that, that red ringed rash is the classic marker for Lyme, right? So the CDC recommends that Lyme disease is diagnosed based on signs and symptoms and the chance that a person has actually had a black-legged tick bite and that you've ruled out other symptoms, and using blood work. The key thing here is that the CDC does not require a blood test to diagnose Lyme. If you've got signs and symptoms and potential for a tick bite, that's a Lyme diagnosis and you can start treatment. So many people with flu-like symptoms come to me and joint pain and every other disease is ruled out. And like, I can't have Lyme because my test was negative. I'm like, well, that's not totally true. According to the CDC, 3 to 30 days, very non-specific, right? Fever, headache, joint ache, swollen glands, and maybe, of course, that famous red ringed rash, right? Very interesting story, Southern tick-associated rash illness can have a rash like Lyme, but not necessarily with the flu-like symptoms. So again, these are some of the classic flu-like symptoms that we look at. Interesting that these also can look like other things like influenza, Epstein-Barr, things along those lines. I've had patients who develop Lyme disease and it set off a weakness in their body and they ended up like getting shingles along with their Lyme. That's kind of miserable. Very often it's been documented other things like Epstein-Barr, you might see things like that. So these are examples. Not every Lyme disease rash is a perfect circle. It can come in all different shapes and sizes. And the CDC says that late stage neurologic Lyme can even go on for years. This is that Alec Baldwin, Hadid, Ali Hilfinger, like some of these famous stories that we talked about. Later symptoms, weeks and months later, severe headache, neck stiffness, arthritis, facial palsy, nerve pain, shooting pain, memory problems, right? So again, very non-specific. If you're an endemic area for Lyme with these symptoms and every other disease has been ruled out, this might be something to really think about, right? So again, very often when patients come to my office, I give them the CDC webpage and tell them to circle exactly what symptoms they're having. So this is my favorite definition of Lyme from Dr. Luft from Stony Brook, who also has contributed to our tick center. Lyme disease is a multisystemic infection caused by the slowly dividing spirochete Borrelia burgdorferi. The organism evades host immunity and can persist as a latent infection, only to reproduce, like be reactivated, giving rise to chronic infection. So if someone comes to me and like, oh, I have a terrible headache, it must be Lyme disease. I'm like, I don't think so. But if somebody says, oh, I have a headache and my joints are swollen, I'm like, okay, multiple systems, musculoskeletal and neurologic, for example. The organism also evades host immunity, which is why when we do a blood test looking for immune response, it doesn't always come up positive. And it can persist as a latent infection, which we just said Stanford had published about in 2016. Now, the exception to this whole thing is if you've got an erythema migrans rash, you've got Lyme, regardless of how you feel. A couple of other interesting facts: patients with early disease who are recognized and treated aggressively do pretty well. If left untreated, the Lyme can spread to the joints and heart and things like that. So as I said, I think that if you catch Lyme disease early, like 90% of people will get over it. But that 10% population can definitely have problems long-term. And we know that Lyme has been reported in all 50 states. Is this because of the people traveling after vacation? Is it because birds will move ticks around, or is it a combination of all? We're still researching that. The classic blood test for Lyme disease is called the ELISA test, but data has shown that the ELISA is not that good. It can miss up to 35% of Lyme disease cases. So the second level we do is what's called the Western blot. And the Western blot looks at antibodies to different parts of how the bacteria works. I told you before, you can have different kinds of Lyme, like neurologic or musculoskeletal, and they can look different on this test. IgM is the marker for active infection, which peaks in about 6 or 8 weeks. And IgG is that more older chronic marker, which can elevate within 2 to 8 weeks. And usually you'll still see IgG when infection is present. Now, when we read a Western blot, it's either negative, positive, or indeterminate, meaning that it's almost enough criteria, but not fully. So that's the interpretation of how we use it. So this is a classic blood test from Stony Brook University: ELISA or serology, IgM, and IgG Western blot. Very important, the Center for Disease Control said some people who get antibiotics early may not develop antibodies and their blood test will never be positive. And again, it takes antibodies weeks to develop. So if you have a tick bite and a flu the next week, don't even bother doing your blood work. But that whole idea about treating with antibiotics early and then your test is never a positive is worth remembering. Standard treatment is 21 to 30 days. Patients may need repeated courses, especially if they have multiple infections. And people may sometimes feel worse before they feel better. That's a medical phenomena called a Herxheimer reaction. And typically that means the antibiotic is actually killing off the germ. Babesia and alpha-gal. Babesia is more of a parasite, which requires a different treatment. And alpha-gal mainly is avoidance and having an EpiPen, Benadryl, things like that around, just in case you really get exposed to something and get a reaction. I found many of my patients with alpha-gal have low immunoglobulin A, like apple, which is from the gut. And I've given them glutamine, which is an amino acid supplement that raises IgA. And again, not official research, just my own observation. It seems like people on glutamine, their alpha-gal numbers are going down. Really interesting. There's so much research on different types of Lyme disease treatment. Johns Hopkins published a big study that showed using essential oils like oregano, wintergreen, clove actually worked against persistent, what we call biofilm Borrelia burgdorferi. You can type Johns Hopkins essential oil into Google. There's a couple of great articles all about that. Really, really interesting. So when we think about the Lyme germ, Borrelia burgdorferi, it's hard to find and hard to treat, right? And this is from the medical book that we're trained in, Harrison's Principles of Internal Medicine. Look at this quote right from the book. The most remarkable aspect of Borrelia burgdorferi is that there are sequences for 100 known lipoproteins, like versions of the germ, more than any other organism around. So that makes Lyme really complicated to treat in many people. And patients may have multiple overlapping infections, right? Somebody, doxycycline may not work, and then amoxicillin works in a few days. Really interesting. The spirochete has proteins that depends on its host. For example, Lyme disease, the Lyme germ loves to eat the mineral manganese, not magnesium, but manganese. So I always make sure my patients are not eating manganese or getting it in supplements. We also know that the antihistamine loratadine blocks manganese, and Claritin has become a really innovative treatment for Lyme disease. Just type into the search bar Claritin for Lyme disease from Stanford. Very real interesting info there. I mentioned briefly about all the other diseases like tularemia, Miyamotoi, Ehrlichia, Anaplasma, and many of these have long incubation periods. Look at this article from the clip from the Center for Disease Control. Babesia, this malaria-like germ, has a 1 to 9 week incubation period. You could be bit in October and develop Babesia like towards Christmas time. Amazing. So one tick can carry multiple infections. Also interesting, the other Borrelia Miyamotoi, which gives high fevers, has actually been shown to carry with it other infections like Tick-Borne virus we talked about, Ehrlichia. And look at this, the Ixodes species of ticks can carry other microorganisms with an unknown potential. So if at Eastern Long Island, we do this lecture again next year, there might be newly discovered infections that we're going to be talking about. So stay tuned. Co-infections, we said, include things like Babesia, Bartonella, Anaplasma, or Ehrlichia. Most people with these other infections probably have some degree of Lyme disease also. Okay, as we wrap it up, we're going to do our pop quiz together. You can answer at home. So ticks only make you sick if they're attached for more than 24 hours. We know that's false, not true, false. Alpha-gal and Powassan virus have a very fast transmission. Lyme is the only serious tick illness, also false. Babesia, Bartonella, tularemia, Rocky Mounted, there's a lot of them. Alpha-gal meat allergy can be deadly, absolutely. Everyone with Lyme remembers the tick bite. That's false. Most don't realize it. The CDC says a positive Lyme test is required to diagnose Lyme. That's also false. We know that the CDC criteria is symptoms and exposure. A tick can give you more than one illness. That's absolutely true. A summer flu could be a tick illness. Also true. You can only get a tick bite in warm weather. Absolutely false. And 90% or more of people with Lyme get over it easily. I would argue that that's true, but the 10% of people where the symptoms last for a long time is a really big population. For us together to fight ticks and fight Lyme and tick illness, it's what you're doing in your yard. It's what you're doing to prevent yourself getting infected. It's the government doing more research. It's our local health department. Vector control in Suffolk is amazing. Vector agencies, whether it's a private company treating your yard or creating a tick-safe area. Healthcare providers, doctors, PAs being vigilant about finding these infections. More research, advancing policy. These are all things that we need to do to really attack this issue. Just a quick advertisement. April 9th in Amagansett. For those Greenport people, you could take the Shelter Island Ferry and join us in Amagansett. Rebecca Young is going to be there with tick flyers, and she'll have hopefully a big box of these tick kits. Take a picture of this flyer. And here's our info on how to order a tick kit. If Karen's able to unmute, maybe she'll give us a word on this. And Rebecca, maybe a shout out about our tick line, if either of you are out there.
Yeah, this is Karen. If you would like a tick removal kit, they're free. And we also send out at the same time the handbook. You can email me directly at the address on the screen, and be sure to provide your name and your mailing address and that you attended this program. You can also call Rebecca on the helpline, but it's probably more efficient to just email me directly since they come out of my office.
Fantastic, great. And Rebecca, I don't know if you're able to unmute and give us a little shout out about the tick line.
Yeah, I'm here. Can you hear me?
Absolutely.
Hi, Jerry. How you doing?
Great.
I'd like to say a wonderful presentation. I
Okay.
get between 800 and 900 calls in the summer of all sorts of tick, upsets, and I use a lot of the information that Jerry gives me. That you can feel free to call me about any kind of issue with the tick bite, all the way from I've been bitten by a tick to I've been sick for 10 years and no doctor can help me. That, of course, is the chronic Lyme. And that's become a bit of a more of a problem. The callers that I have become much more sophisticated in their questions in terms of, lab, comparative lab values and different diseases. And there's a lot of talk about alternative medicine. So it's getting a lot more interesting and more complicated. So no question is a stupid question. And I encourage you all to call, and I'll do my best to help you or refer you.
Fantastic, great. So a couple questions here. Number one was, what about this Lyme disease vaccine, right? There was a Lyme disease vaccine which was taken off the market because of lack of use. There was some data about maybe it might trigger Lyme disease in patients that had it and were asymptomatic. And there is some research now on the Lyme disease vaccine. The issue that I have is there are so many types of Borrelia. There's Mayoni, there's Miyamotoi, Burgdorferi. I think it's going to be very hard to get a vaccine that covers all those strains of Lyme disease. And you still have to be worried about Rocky Mountain spotted fever, Ehrlichia, Anaplasma. So the only full protection would come from a vaccine that covers everything that could come from a tick. If you have a Lyme disease vaccine, you got to be just as worried about alpha-gal and Rocky Mounted as everybody else. So there's still a lot of challenges to a vaccine, in my hot-headed opinion. Deb asks if doxycycline was considered successful, is there any long-term effects later to watch for? So yes, Deb, most people, if you're on doxycycline, you'll know typically in 3 or 4 weeks if it's working. Some people need 6 or 8 weeks. And for your average person, doing 4 to 8 weeks of antibiotics, as long as you've got a good probiotic going to keep your gut healthy, we really haven't seen any long-term effects. It's the long-term effects of untreated Lyme, like Justin Bieber and Yolanda Hadid and those people that we're much more nervous about that way. And let's see. So where do we send the tick for testing? Tick Encounter and Tickgenics are 2 of the more famous companies, and I believe that Rebecca has some info on that, and I'll go back to that slide and give you that info in a minute. Yeah, so is there symbiosis with the virus and Borrelia burgdorferi? That's a good question. There's actually this concept of nature of what's called endosymbiont, where germs live inside of other germs. And they've actually found that Borrelia can be endosymbiont with especially tularemia and with Bartonella. And they're still trying to figure that out because typically the viral host is more of the Lone Star tick. So that's a great question. Yeah, so can it go to the adrenal glands? They haven't documented Lyme in the adrenal gland as of yet that I know of, but they definitely have found it in liver, spleen, cartilage, huge in synovial fluid. One of the landmark Lyme pathologists, Alan McDonald, documented it in brain tissue. Really kind of scary. You know what I mean? Yeah, correlation between Lyme and Epstein-Barr, right? So there are some studies in people that have chronic Epstein-Barr. For example, Dr. Patricia Coyle, another member of our tick team, always reminds people that 100% of her multiple sclerosis patients have Epstein-Barr. And we have seen some relation between MS-like symptoms and Lyme and Epstein-Barr. We also know, as I said, people who get Lyme disease can trigger, I've seen people who get Lyme and they break out in shingles, which is the varicella chickenpox type virus. So number one, Lyme and Epstein-Barr can have very similar symptoms. Having Epstein-Barr with a tick bite can make Lyme more symptomatic. Having Lyme with old Epstein-Barr can definitely reactivate that. Great, and our last question is the Claritin length of treatment for Lyme as long as doxycycline. There's 2 schools of thought for that. One school, they're using it for 3 months, and another school, they're using it for 21 to 30 days, which hasn't gotten really a lot of traction because it takes time to knock that manganese load out of your system. Christina, yes, save the moose. Moose are dying. There's less than 900 left. We have to save the moose. Good way to end. Let's see, any other closing thoughts? Karen, or I don't know if Linda's back from Eastern Long Island.
Hi, I'm here.
Oh, great.
I
Fantastic.
think one more question just came in the chat.
Oh, yep. Here it is. My
my-
son has alpha-gal, right? So yeah, Barbara, we've seen that kids especially can grow out of alpha-gal for sure. Kids especially can grow out of alpha-gal. The avoidance really is key. Again, my own private data shows that immunoglobulin A, IgA, a gut marker, tends to be lower in people with alpha-gal. maybe getting that tested the next time he has blood work, or the next time you're at the store, you could consider supplementing with glutamine, which is a nutritional supplement that helps that particular marker to increase. And again, Rebecca has info on our local alpha-gal expert who sees kids all the way up to people in their 90s with alpha-gal. Great. Again, I had a great time. You could probably tell I could keep talking on and on, but I think we'll wrap it up for here. And we'll see you next time at Eastern Long Island and our Southampton Tick Center. So
Thank you so much, Jerry.
you bet. Have a good night, everybody. We'll see you
Have a
later.
good one.
You bet. Thanks.